The endocrine system. Access and deficiency. An access too much or deficiency to lack of circulation hormone. Cause of wide range of medical condition, for example, hyperthyroidism and hypothyroidism, where, where there is excess of hormone. One form of treatment consists of giving the patient some time with inhibits, inhibits the production of the hormone, as in the use of carbimazole. So treat hyperthyroidism when at hormone deficiency. Treatment may be replacement therapy, for example, injection of insulin in the treatment of type 1 diabetes. Doctor says, suffer of type 1 diabetes are deficient in insulin. Negative feedback system. 1. TRH is secreted in the hypothalamus and triggers the production of the TSH in the pituitary. TSH stimulates the TSH receptor in the thyroid to increase system syntax of the both T4 and T3, also to release short hormone, producing increased plasma levels of T4 and T3. T3 feedback of the pituitary pairs the hypothalamus to inhibit TRH and TSH secretions. Goiter, a large thyroid gland in the colon goiter, the enlargement may be diffuse, involving most of the gland are localized limits to particular area, as in a solitary single node. The increased blood flow in diffuses and large, for example, in Graft disease, may give rise to a potable vibration felt with the hands and audible wind, nose, hair, throat, on a stethoscope over the gland. A letter of referral. Mr. Daddy's doctor has referred health to an endocrinologist. Dear doctors, I will be grateful if you will send the fighting gel of woman who has lost 20 kilos and went in the spot of aging more than usual. She described herself of better type and at first she thought the weight loss was the tutorials. With more recently, she has developed palpitations, diarrhea, and heat intolerance. She has noticed tired hand have a tendency to sharp. Her symptoms she has hyperthyroid, hyperthyroidism, and he was confirmed with me examination with gravel and a large thyroid, red sweat, pulse, and fine tremor of the hand, head intolerance, inability to cope with the his temperatures, overactive, more active than is usual, palpitation, evidence of rapid or irregular heartbeat, fine tremor, very slim involuntary movement. En Spanish, exceso y deficiencia. Un exceso demasiado o una deficiencia demasiado poco de hormonas circulantes causa una amplia gama de afecciones médicas, por ejemplo, hipertiroidismo o hipotiroidismo. Donde hay un exceso de hormona, una forma de tratamiento consiste en dar al paciente algo que inhibe la producción de esa hormona, como en el uso del carbimazol, para tratar el hipertiroidismo. Cuando una hormona es deficiente, el tratamiento puede ser mediante terapia de reemplazo, por ejemplo, inyecciones de insulina en el tratamiento de diabetes tipo 1. Los médicos dicen, enfermos de diabetes tipo 1 son deficientes en insulina. Sistema de retroalimentación negativa. TRH, hormona liberadora de tirotropina y secretado en el hipotálamo y desencadena la producción de TSH, hormona estimulante de la tiroides, en la hipófisis. La TSH estimula el receptor TSH en la tiroides para aumentar la síntesis de T4, tiroxina y T3, triodotironina, y también para liberar hormona produciendo un aumento de los niveles plasmáticos de T4 y T3. La T3 se alimenta de la hipófisis y tal vez del hipotálamo para inhibir la secreción de TRH y TSH. Voz. Una carta de remisión. Le agradecería, doctor, una carta de remisión al médico de la señora Downs le ha remitido a un endocrinólogo. Estimado doctor, le agradecería que viera a esta mujer de 50 años que ha perdido 20 kilos de pesos a pesar de comer más de lo habitual. Se describe a sí misma como hiperactiva y a principio pensó que la pérdida de peso se debía a esto, pero más recientemente ha desarrollado palpitaciones, diarrea o intolerancia al calor. Ha notado que sus manos tienden a temblar, sus síntomas sugerían hipertiroidismo y esto fue confirmado por un examen que reveló un agrandamiento de las tiroides, palmas rojas y sudorosas y un fino temblor en las manos. Intolerancia al calor, incapacidad para hacer frente a las altas temperaturas. Hiperactiva, más activa de lo habitual, palpitaciones, conciencia de latidos cardíacos rápidos o irregulares, buen temblor, movimientos involuntarios muy leves. Exercise 80.2. Complete the table with word from A, B, and C. A process on relevant form to a straight mark in the front of the straight syllable in each word. The first one has been done for you. Verb, inhibit, not innovations. Innovations. Produce, productions. Relax, replacement. Secretions. Simulations. Complete the page from a textbook using the illustrations on your own. Look at the opposite to help you. Pulse of GNRH are released from the hypothalamus and stimulus LH and FSH relax from the pituitary LH stimulus testosterone production from brain cell of the testes. Te- Testosterone from back on the hypothalamus pituitary to the inhibit NRH secretions. FSH stimulates the sertoli cell in the symphymus tubes to produce mature sperm and the inhibits A and B inhibit cause feedback on the pituitary to decrease FSH secretions. 80.3. Complete the sentence. Look at A and C opposite to help you. Differences changes affect many parts of an organ or gland. And look at changes affect only one part. Is this difference in iron? His done car in iron. Excess T4, T3, and T4 increase the basal metabolic rate. Match Mr. David Simpson with the question, how Dr. Look on the opposite of help you. Diarrhea. Are you well normal? 80 more. What is your appetite like? Health intolerance. Do you prefer hot weather or cold? Overactivity. Are you able to sit and relax? Palpitations. Have you ever felt your heart beating rapidly or irregularly? When the loss is you when standing tremor, do your hand shake? Finish.